Hey everybody, welcome back to Dental Unfiltered. I'm Matt Brown, and I'm here with my normal, awesome co-host, Dr. Andrew Vallo. And today we have an awesome guest, someone I've known for years and worked with for years. Have had a really great relationship with. I've watched this individual grow a practice in rural Dakotas and literally amazing. Everyone says either my market's too saturated or my market's different. You don't understand it. It's rural. And I've seen it all. And Kyle's probably, out of all my stable of docs, been the most successful growing in a rural environment. I think Dakota is extreme compared to the rest of the country. And he's just really talented entrepreneur. He's done some amazing transactions. And I've had a pleasure of being in the front row for a lot of this and being able to watch it. And it's been really exciting for me over the last few years. So Kyle, why don't you just tell the audience a little bit about yourself?
Yeah, Matt, I appreciate that. You've been a pretty big part, your marketing company, Energize, we've used you extensively. And so you've been a big part of my journey. So I appreciate that. But I'm originally from Colorado, Cortez, Colorado, small town. So I guess I'm made for rural America. Went to dental school in Salt Lake City at the University of Utah and bounced around a little bit trying to figure out what type of practice I want to do, what type of dentistry I want to do. Always had an entrepreneurial itch. So definitely not at the level of Andrew, but I'm working toward that. So ended up working for an implant only, a couple of them, implant only centers, got a lot of training, got a lot of reps and full arch implant rehabilitation that way, and decided type of dentistry I want to do incorporates both general and implant to have the general base and then implant heavy cases to sprinkle in on top of that. And so that's kind of the dentistry that my practices are focusing on right now. So a few years after school, came to North Dakota, bought a practice up here, and I've just been slowly building with Energize's help.
What brought you to North Dakota?
I wanted to go into an unsaturated market in terms of demographics and the number of dentists in general, and dentists that were doing full mouth implant rehabilitation. There wasn't a lot of practices marketing for it. It's slowly catching on a little bit more.
So there's more than one dentist in North Dakota then?
Yeah, there's about 5 of us.
There's been a lot of conversations over the years about, should you go rural, should you go urban, should you go where you want to live? And I think you're a testament to how well it can work out if you're willing to make that jump and to go into somewhere rural. And it sounds like it's really been a great success for you out there. I am curious, so you went there wanting to find a market that wasn't very saturated, and from a business standpoint, it sounds like it worked out well. Was it difficult to adapt from a personal life standpoint going into a more rural area than you were used to? Did you have any challenges there? I just like to hear more about that.
Yeah, from a personal lifestyle standpoint.
Yeah.
Really for me, because I was so focused on growing my business, my day-to-day doesn't change no matter where I live. I've got my wife, a few kids, so my routine doesn't really change. Maybe on the weekends. My wife was awesome, or is awesome, for allowing me to drag her up here. But we've actually, and I think this is true with any place, you kind of grow to love where you're at. And so we have really come to love North Dakota, the people in the area that we're in. We've got some lakes, some hills, not really mountains, but there's lakes that we go boating on, and there's a ski resort up here actually that we go to. And so there's more to do. It surprised me. There's more to do than what I thought I was moving into.
That's cool, man. I ask partially because I think our listeners are interested in that, just because I know that there's different listeners considering different opportunities. And I get asked that question, about looking at demographics, and I get told oh, well, in my market, this wouldn't work. And, I'm of the mindset that you can be very successful in any market. I think there's different strategies that you have to use in different markets for sure. And I think that there's positives and negatives of each market, but I've always given the advice that I think you should think about where you and your family want to live. And part of the reason I feel that way is because I know a dentist from one of my mastermind groups that had moved his family out to North Carolina for an opportunity that he thought was a really good practice opportunity. And it was, I mean, the practice worked out really well. But they realized like they were more rural North Carolina, and it wasn't a good fit for his family and like what their lifestyle was, what their values were, whatever. And so they ended up selling the practice and moving to San Diego, which was a much better lifestyle fit. But now is struggling out in San Diego in a super saturated market. So like from a business, so it's interesting to think about the different dynamics that go into that. But
I will say where we live is a town of 50,000. So it's not like when we go rural, we're going to a town of 3,000 or 4,000. I don't think a lifestyle standpoint that would have worked for us. Yeah. So I would say we're semi-rural, not rural,
what does your day-to-day life look like right now, Kyle, as a dentist and business owner? How much clinical dentistry are you doing? How much admin time do you have, that type of thing?
This is one of the things that I wanted to talk to you about as well, because you've been through that transition. But I'm still working about 3 days clinically, and then I'm a backup for the associate dentist if we have one transition out or one wants to go on vacation for a week or something. I'm still the fallback guy for the group.
Break glass in case of emergency, that type of a thing. How many associates do you have?
There's 3 of us. 3 associates plus me, so we've got 4.
For how many practices?
5 practices. 2 of those practices they're about an hour outside of where I'm at, and they're smaller, so they're not open every day. So those are on abbreviated schedules, so it works.
Interesting.
I guess going back to the living in, a rural area, because the practices have been successful, that has allowed us to travel, which has made a big difference too. So if we didn't have the means to travel, I think that would make a difference as well. So being able to get on a plane and go on vacation for a week, every other month or whenever you need to, I think that also makes a difference.
That does sound nice. How old are your kids?
We have 4, so 0, 2, 4, and 6.
0.
My wife had a baby a month ago, so we're in the weeds here.
Congratulations. We got one that's about to turn 2 months. So that's impressive that you guys are still traveling, or maybe it's on pause for a little bit. I know for us, we're taking a little bit of a break from too much traveling with the newborn, but I can imagine that keeps you busy, man. Trying to juggle 5 practice. I'm assuming 3 days a week, you're probably working at more than one location. Is that right? Or
yeah. Yep.
Yeah. And 4 kids, man. Yeah. You're busy. I think it is time for you to think about, if you want to keep growing your group right now, I think it probably is time for you to think about cutting out that chair time and getting some more associates in there. But I'm happy to talk about that. I'm happy to talk about whatever. So I guess Kyle, I think part of this podcast was, what are your kind of goals over the next, 1-3 year marks, and, what things can we help you with? What decisions are you kind of struggling with, or what pain points do you have in your group, or anything like that?
Yeah, I appreciate that. A couple of things I wanted to get from you is did you have the vision of where you're at now to begin with, or has that evolved over time as you've grown from 1 to 3 to 5 to 10?
I don't think I ever had a number in mind. I think from day one, I was very intentional about wanting to make my practice as successful as possible. And I think it's like really like an itch for growth. I think it's like, hey, I want to be intentional to grow this practice as quickly as I can. And then as good opportunities arose, I just pretty much always said yes to them. So, like when I first set out to create my first startup practice, I don't think in my mind I was like, I only want to do 1 practice, or I want to get to 5, or I want to get to 10. I think it was just like, hey, I want to grow this thing as much as I can. And that mentality has kind of kept up as time has gone on.
So at what point do you feel like were you reactive? Did you start reactive from a reactive mindset of putting out fires? And at what point did that change to being proactive about planning your growth and your schedule and your days? at this point with 5 practices, I don't need to add more practices. I need to systemize things and centralize some services. And so I need to transition from being reactive to daily and weekly fires and to getting the systems in place and being proactive about it all.
Yeah, I have a few questions for you. I think the first thing that comes to mind, though, is, I do agree with you in a sense that, it sounds like these practice, at least for the most part, aren't near capacity. It sounds like, you said 4 doctors for 5 practices. They're not all open every single day. And I understand it's a more rural environment. So I guess it may be tough for me to compare it to, our practices here in Florida. But one thing that I've realized over time is how beneficial it is to have more availability for patients, more provider days, more hygiene days, more doctor days, more doctors per location. That was a shift in my mindset. So like when we first opened, the first few practices, and even honestly up until like last year, man, I was very of the mindset, open at 3 days a week and then grow to 4 days a week. And that's it. And some of my practices, I was like, I only need 1 doctor. And like we had some bigger locations where I was like, we're going to try to get to 2, no weekends, no 5-day weeks. And I've kind of realized over time, I think part of that was trying to make the practices, as efficient and profitable during the time that they're open. I'm like, okay, more time means more payroll and more doctor pay and, all that stuff. But like over time, I kind of realized like, one, our doctors are really compensated on a percentage of the production they do. So like adding more doctors doesn't really add more doctor compensation. It means that, if the doctors want to make as much income, like the practice is going to produce and collect more money in order to sustain that. Obviously the other employees is not the same way. So, you add more days, you're adding more, hygiene pay and assistant pay and all that stuff. But over the last year or so, we've had some practices that I would say weren't even like fully at capacity, but we had the opportunity to add more doctors. Like we just had a doctor who randomly had posted on Facebook, they wanted some Saturdays and we had never thought about doing Saturdays. And we're like, you know what, like, sure, why not? Let's try it. And Saturdays have been some of our biggest production days. They've really been awesome. And we actually, because of that, we had another doc internally who was interested in more days. And so we added Saturdays for him. And so we have these 2 docs that rotate between like 5 different practices, and each practice is open like 1 Saturday a month. And it's added some really nice revenue to those practices and availability for our patients. We've now got 2 of our practices that we're open 5 weekdays. And again, like our model was always 4 days a week. Like we were either closed Mondays or closed Fridays. But I'm just realizing that, we've got doctors who are interested in working more days, or we've got some doctors who are looking for part-time work from their other job. That's my first thought for you guys is like, you could add more practices. Like we kept growing even before practices were anywhere near capacity. We've done, 11 startups in 5 years. So I'm not going to sit here and say that we like grew to capacity and then added more. But I think you've got 2 good paths and you could do a little bit of both. And that's kind of what we're doing right now. We are still adding more locations every single year, and we've got plans, for the next round of additions, but we're also trying to increase same store growth by adding more, provider days at a lot of our locations as well. So I think that's something good for you guys to think about there. My question for you is like, what does your leadership team look like with 5 practices and you practicing 3 days clinically?
Yeah. So right now I'm overseeing it all. What I need right now is I need a regional manager or a personal assistant or something, but I've got a main contact or office manager in each location. I'm overseeing everything. So there's a lot of people answering to me. So
the answer is yes, pal. You absolutely need to add to your leadership team at this size. And, I don't know, and I don't want to, ask you questions about numbers because I know not everyone wants to share those things, but from what Matt said, it sounds like your group is doing well. You've got 5 practices. You're practicing 3 days a week clinically, and you basically have no executive team. I think that's definitely holding you back, and that's probably adding a lot of stress to your plate. And you're probably So it's funny, Matt and I, we just finished our own recording session. We recorded 5 episodes here already this morning. And some of the things we talked about are literally things that you and I are talking about right now. One of those things is CEO decisions. And it's like, as CEO of the group, you really need to be focusing on things that are really going to move the needle. And my guess is you're focusing on a whole bunch of bullshit that doesn't really matter because you're the only person who's sitting in that chair right now. So I think that's one side of the equation. The other thing we talked about is like seasons of an entrepreneur. It's like in the early seasons, at the beginning stages, you do have to be that wears all hats, E-Myth type of thing where you are the clinician, you are the, office manager, you're the CEO, you're the regional, you're everything. But as that group grows, it allows you the ability to build an executive team. And like, that was the best thing. The best 2 things that I did over the last 18 months was, one, to get myself out of the chair completely. I was playing 2 parts. I was like part-time dentist, part-time CEO, and I wasn't doing a great job at either of those roles because my focus was split. But the other thing was I put a lot of time, effort, and money investing in our executive team. And so, we're at 11 practices. So like, I'm not saying that you need this executive team right now, but just so that you can compare it to what you're currently doing at 5 practices, our executive. So we've got office manager for every office. Every office should be self-sufficient with that office manager running it. But then outside of that, we've got 2 regional managers. We've got one for Tampa region, one for the South region. Yes, I think you definitely need a regional manager for those 5 practices. We've got chief hygiene officer that oversees all of the hygienists for the practices. We've got a chief sales officer that oversees all the treatment coordinators for all the practices. We've got a director of doctor development and relations. Now there's only 4 docs, so then maybe you don't need that right now. Maybe you could still do that role right now. But if you do add more doctors, eventually it's probably good to have somebody else in that role as well. We've got a chief operating officer that basically runs the day-to-day for the entire organization. We've got a chief financial officer. We've got myself as CEO. We've got my business partner who's chief dental officer. So we've actually got 2 different executives on the doctor side of things. And we've got a talent acquisition specialist who's our hiring manager who does all the hiring. So, I mean, if you think about you're doing everything and we've got literally a different person for like each subset of leadership within the organization. And I understand, 5 to 11 offices, but I think it's probably time for you to add a couple positions. I think for one, regional manager for sure. I've got my own executive assistant. Our COO has his own executive assistant. I think you need an executive assistant for sure. And potentially even one more leadership position outside of the offices, could be good right now. Whether that is, a COO, I don't know necessarily, because I'll be honest with you, we added a lot of these positions in a short period. It was like we were behind though. Like I wish we had added more of these positions earlier. I think we'd be in a better spot than we are now. So I kind of like panicked and was like, oh man, like our group grew faster than our leadership team did. And we need to add a bunch of leadership in a very short period of time. I would say for you, like, don't go too crazy. I think it would definitely benefit you and you'd see positive ROI if you added a couple of those leadership positions to take more off your plate. At the same time, look to add some more associates and look to cut back your clinical time so that you could really be a true CEO from the group.
That touched on a couple other questions as well that I wanted to ask you. So adding executive team members, what other things have made the biggest impact or have been game changers in terms of you stepping out of the chair and helping your group to grow like they did? Were there systems or technology or any outsourced services? What things can you think of really were game changers along the way?
So I guess like some of the biggest impacts on our growth, like some of them are things we've been doing this whole time, like marketing since day one, heavy invest. And I know, you're working with Matt, that stuff. Outsourcing. We outsource certain things from day one. We actually just did an episode where I answered a listener question about call centers. I mean, I have used a call center for all of our new patient phone calls since day one. I think that's been huge for us. So that hasn't been a change, but I think that's been a big part of our growth. Like some of the changes we've made over the last year or two that I do think have had a huge impact. One is really focusing on our sales system. So we've had this big evolution over the years where when I first opened, we didn't have treatment coordinators. We just had whatever employees presenting. We had assistants presenting treatment. We had hygienists presenting treatment. We had office managers presenting treatment. We didn't have real training on it. We didn't track metrics like close rates or anything like that. And then over the years, we're like, okay, we need treatment coordinators. I wanted designated people who were trained to do this role, doing that role. Okay, it's like things improved. Okay, we need to actually track metrics for these treatment coordinators. So we've gotten more and more advanced with the different metrics we're tracking for each of the treatment coordinators. Man, we really need someone to oversee all of the treatment coordinators. That's when we brought, appointed our best treatment coordinator to chief sales officer. And she, has one-on-one calls with the treatment coordinator. She has meetings with all the treatment coordinators. Okay, things are getting better. Then I went out to Alex Formosi's course in Vegas. And, at that point, I thought we had created a pretty good sales system. And I realized like ours was literally like amateur hour compared to what the real companies were doing out there. And I learned a couple things about creating, better sales systems, and came back and like doubled down again on our entire, sales system, presentation, metrics. We started doing scheduling, follow-up financial consultations for anyone that didn't actually close on treatment same day. Then we started offering $200 gift cards for them just to come back to these financial consultations. So like that has been a really big focal point for me in the group, like I'd say over the last 18 months here. And we've just seen like leaps and bounds in improvement in treatment acceptance, in revenue and production, all that stuff. That's probably been one of the biggest levers we pulled. The other one I would say is interesting. It's actually, so you had talked about how your group, you're focused on providing both implant and general dental services. When we first started, we had some implant only offices and we had some general only offices, and the general offices didn't really do implants. And the implant offices only did implants. And we kind of realized the same thing over time, was like, hey, you know what? It would be better to focus on just building these awesome, well-rounded practices that do a bunch of implants and a bunch of full arch work, but also do general dentistry. And so we've really found this avatar for our associate docs, which typically speaking is a doctor who has the advanced surgery training. They can do the all-in-X cases, but they're also able and willing to do general dentistry. They're willing to do root canals. They're willing to do, some cosmetic cases and basic crown and fillings and whatever. And so that like finding these like super producer, well-rounded doctors, it's allowed these practices to explode. So, ever since we've focused, like ever since we've changed paths, and like this has been how the last couple practices that we started up have been, like we are having our best starts ever, where the last two practices collected like $253,000 and $242,000 in their first month open. And I think the main reason was because we found these superstar docs who are willing to do everything, and they're basically filling their schedules with production from day one.
I'm pretty lucky here. All three of my associate doctors are super producers, and they are trained in full arch. One of them lives here. The others, we've been able to draw them. They fly in, they're working every other week. So, but that's how we've been able to get them practicing here.
Have you had trouble with recruitment being in that part of the country? Like, is it a struggle for you to find doctors? Are there enough associates in that area? Is it easy enough to bring people to that area?
It's hard to find associates that have wanted to move here, but I've been able to find well-trained high producers that are willing to fly in and fly out, because there's so much need here that their skill set is being maximized while they're here, keeping root canals in, surgeries in. And so their daily production is really high, although the practices aren't open every day.
What are you doing for doctor retention? Like, obviously, it sounds like you've got some incredible associates who are, some of them are willing to fly in and fly out, on a weekly basis, and they're doing big production numbers. It's like, what do you have set in place to try to make sure that they want to stick around long term?
That's something that I need to establish. So I've spoken with a couple of them about ownership opportunities, and so we're working through that. I know you've got a great structure that I want to learn more about, but I do want some high stickiness, right? I want to keep the guys I have because I really like them. So I think as long as they're producing, they're happy. But I think it needs to be more than that. I think they're they're interested in ownership here, and so
especially if you do want to keep scaling and growing. I think right now, man, like you're at this fork in the road where you've got like two different paths. And one path is you're like, hey, I don't really need or want more offices. I'd rather optimize these 5 I have and add additional doctors and stuff. I think if you go that path, the stickiness is a little bit less important because now you're, especially if you add some leadership positions, I think the benefit of having multiple doctors per practice is you're a little bit less worried, like, what if an associate leaves? And you're less worried about yourself having to step back in the chair. Whereas if you're going to keep adding more locations, like having at least one strong, sticky doctor at each practice is huge. It helps you sleep at night. And so like, we've done one is we've got the long notice periods. And like, I've had docs try to negotiate that. And I'll tell them like, that's one thing, like we won't negotiate on comp structures. All of our docs are paid exactly the same as far as percentage of production, all that. And we won't negotiate on the notice period. And I tell them like, because we're growing this group so quickly, like myself and my partner, Sasha, like we need to be able to sleep at night. And knowing that a doctor is not just going to leave us high and dry before we have time to replace them, that allows us to sleep at night. So like, that's a non-negotiable for us. So we've got 120-day notice periods with like pretty big penalties if they don't give us that full notice. And so I think that has taken a lot of that fear away from growing quickly. Like, oh my God, what if a doctor quits or whatever? We know even if a doctor decides to leave, we're going to probably have ample time to replace them. But the other thing is, as you mentioned, like the equity model, and by the end of this year, I expect the majority of our practices will have at least one doctor that has at least a small piece of equity, ownership in that practice. And that's huge. I mean, again, you want these great doctors to want to stick around long term, and honestly, like I want them to be rewarded if the practices keep growing. I mean, I'm not in there producing dentistry; they're the ones in there doing the dentistry. So if we can find like a win-win situation where I'm not giving away too much equity, but they're getting a piece of the pie, and that's motivating them to keep growing the practice and to stick around, like that's huge.
Yeah, I agree. I've got one more question, if that's okay.
Yeah, go ahead, man.
What decisions have you regretted the most along the way, or have caused the biggest headaches that maybe you've had to undo or fix?
That's a great question. I honestly don't know if anyone's asked me that before. That's a really good question. I don't know if there's any decisions that I like really regret looking back on. There were things that caused temporary pain and inconvenience, but I feel like in the end, and I'm sure that there's probably something that I'm not thinking about right now, but in the end, I feel like for the most part, they worked out pretty well. I'll tell you, like at the time, one of the things I really regretted was when I opened practices 3 and 4, which we did. This is the only time we did this. It was 2 practices in one location. It's a 4,000 square foot building with some shared spaces. We have an implant office on one side of the building, a general office on the other. But it was a ground up construction, new build to suit. Unfortunately, because of it, like the contractor owned the whole, like he was developing the entire business park. So like you didn't get to pick a contractor, like this is who came with it. He was like, honestly, like, I'm not even joking. Like he's a criminal. He is like in lawsuits and stuff. He just like, I think he took on way more projects than he could handle. And like this was a couple of years ago that this all was happening. There are still buildings in that business park that aren't complete a few years later. And like the whole thing was supposed to be done in like 12 months. So anyways, like that was a nightmare situation while it went on, because like originally we were supposed to open in like June and we didn't open until the following January. And it was like, and he wouldn't just tell us like it was way behind. It would be like, oh yeah, we're just running a little behind. It'll be a few more weeks. And like, this just kept happening. And like, at that time I was naive. I didn't realize how long these projects could be delayed. And so like I had already pulled the trigger on like ordering all the equipment and paying for all this stuff and had associates already hired. And like, it was like probably the most stressful 6-month period of my life from the time that the delays started until we actually got those practices open. And I remember in that time thinking like, why did I do this? I had 2 great practices. I should have not done this. And now 2 years later, like in 2026, those 2 practices should do about 6.5 to $7 million this year. So again, in hindsight, was it worth going through like a decision that I thought was a bad decision because we faced this terrible situation with these delays? It was a painful situation and I thought I made a huge mistake, but at the end of the day, once things kind of all played out, it actually turned out great. And I'm glad I made that decision, even though there was some temporary pain there. And I would say for the most part, that's what's kind of happened. Like maybe I made a bad hire for, a position and I learned from that situation and I went on. Early on, this was something I would say, I thought I had to pay a certain percentage of collections to attract the, more skilled, more experienced, higher producing doctors. And I realized over time that I don't really have to do that, because what I realized is we provide an opportunity to produce more than 99% of the practices out there. So a doctor in our practices can make significantly more money at 30% of adjusted production than they can at 35% at a practice down the road. And what I was doing is I was just hurting our margins by trying to offer higher percentages. And like once you get a doctor at a higher percentage, it's really hard. And we did in one case, and eventually that doctor left, but it's really hard to pull that back. So if I could go back and do everything all over again, I would have just from day one set our standard at that 30% of adjusted production, less 30% of lab bills. And I would have had all of the doctors on the same compensation structure from day one, because that would have saved me a lot of havoc and hassle, and it would have made my practice more profitable in the early years too.
Awesome. Thanks.
This was a really cool episode for me because you're both docs that I've worked with and watched grow, and seeing you guys get together is really cool. We're raffling off 10 slots for Dr. Vallo's Summit coming up. I have 3 tickets I can personally give away, and only 3. Dr. Vallo's been really stingy with me having tickets because he knows I'd give away 20. But Kyle, you are one of the 3 that I'm giving away to go to the summit. I know you've been wanting to go, so you're going to be one of the 3. Just start looking at travel and hotels now. I got 2 more tickets to give away. I have an idea who's getting them, but you were one of the ones for sure, no matter what, was getting it.
You're going to get harassed after this, I think, Matt.
I only have 3 to give away.
And you're going to have some people pissed. Well, yeah, okay, to be fair, though, I gave you guys 13 because we're raffling off 10 spots, too. And you kind of pressed me for those extra 3, but we'll make it work. It's going to be fun. I'm looking forward to meeting you in person there, Kyle, and, talking some more. And the cool thing is, like, I'm going to be there, but like this executive team that I talked about, as you're sitting here thinking about how you can start building out your executive team, you're going to get to actually see my executive team in action, and you'll get to, talk to different members of the executive team. And I think that'll make it easier for you to see, how much value there is in putting something like that together for your own organization. So I think that'll be really helpful for you, hopefully.
Oh, I know it will. I'm excited. I appreciate that, you guys. Yeah, I'm excited to meet everybody and learn what you have going on.
So Kyle, was this beneficial for you, getting time with Dr. Vallo?
Absolutely. Yeah, of course. And I appreciate it, you guys.
Awesome.
Of course, listen to the podcast and have been on the Facebook groups and seen your posts and kind of following right from a distance what you've done and have been really impressed. So I was excited to meet you here on this podcast and in person in Florida.
It was great learning a little bit about your group. It sounds like you're doing something awesome out there in the Dakotas, and I'm excited. My hope is, when I see you in a couple months that, I hear that, you've made some changes to kind of help take your group to the next level. And I hope if we do another podcast that we get you in a studio instead of in your car there. But it was nice to meet you, Kyle. I hope you have a great rest of your week there. It's always fun having guests come on. I know Matt does a lot of the guest episodes, but just because of my schedule mainly. But Matt was kind enough to work it out with you that he kind of just popped you right into our normal scheduled slot. So that worked out perfectly. Matt, I'm thinking here out loud, if you've got some other docs in mind, like Kyle, we can maybe make this kind of like a recurring theme where, every couple months we could record a guest episode with another doc, and they could kind of ask me some questions, and we can talk about, stuff to help them take their practice or their group to the next level. So this could be a new fun segment for us.
There's no shortage of docs who want to talk to you. When I go to a dental event, I come off stage and my questions I get is, how does Dr. Vallo do this? How does Dr. Vallo do that? It's kind of like some people think it's like Batman and Robin. It's really like Batman and Alfred. Like it's so funny. I get asked about what Andrew does all the time, and people are like, how can I get in touch with Andrew?
That makes you Alfred, is that right?
Yeah. People ask me all the time, like, how can I get in touch with Vallo? I'm like, listen, I can't get him on the phone. The only time I talk to him is when we record. So, Kyle, this was great. I think that would be a good segment. I can get a list of docs put together in like 10 minutes that I know would want to talk to you. So, hey guys, there's no revenue made from Dental Unfiltered. We don't sell anything. There's no product placement. Please like, share, subscribe, follow, and please leave a review. We read the reviews. They make us feel good about this. This is a passion project for me and Dr. Vallo. Thank you guys so much, and have a great day.